This is Disabled Veteran Radio. My name is Mr. Bill Apgar. How are you on this Friday? We've been playing music on the show, and Boss Hog, he says, Bill, you need some more informative issues on your program. And I said, well, I can do that, Mr. Boss Hog. So that's what I'm doing today, and I'm at the place where I always go for treatment, which is in the Villages. That's Legacy Chiropractic Clinic, which is located at 1950 Laurel Manor Drive, Building 200, Suite 204 in the Villages, 32162, and their phone number is 352-259-0024. And on the program today is Dr. Chris Kessler, who is from Legacy Chiropractic Clinic. Now, I will just let you know, in the Villages, there is the VA there, and they do good work there. So if you do go there, hats off to you. But if you'd like to go outside the VA, which, there are many other businesses in the Villages, the one I go to is Legacy Chiropractic Clinic, they do excellent work on my back. And he's here today on the program. Dr. Chris Kessler, how are you today?
Doing fantastic, Bill. Thank you very much for having me on the show.
And you have lots of disabled veterans that come out to your facility, is that correct?
We certainly do.
And what is the biggest issue that is they're concerned with their back when they come to Legacy Chiropractic Clinic?
I mean, Bill, we treat dozens and dozens and dozens of VA patients and disabled veterans throughout every single week here at Legacy Clinic. And over the last couple of years, we've actually had more and more patients come over from the VA. And we have patients coming over with all different types of issues. We have patients coming over with a lot of lower back issues, a lot of injuries that they sustained many, many years ago. We have patients coming in with neck issues, with radiating pain down the arm, with patients who have lost strength and mobility, and with patients who are just kind of feel achy and tired all over. And the wonderful thing that we're able to provide for a lot of these patients is some certain types of care that they're not able to get underneath the actual ceiling of the VA right now. So we're able to do a huge host of different things, and the VA has been absolutely fantastic for us to work with because they give us this huge range of things that we can actually do with patients. So we have full availability to all the different things that we have here in our office. And our office is an incredible place. So here at Legacy Clinic, we offer not only chiropractic care, but we also offer massage, acupuncture. And so if a patient comes over from the VA, there's a huge plethora of things that we can do with them. Not only just adjusting from a chiropractic standpoint, but we can go much deeper than that. So we have patients coming in perhaps who've been having lumbar degeneration and radiating pain down the leg, sciatica. And for some of these patients, we might do some decompression therapy. Decompression therapy is an incredible apparatus that we can put a patient on that literally helps to decompress the spine where nerves have gotten pinched or arthritis is formed to slowly take the pressure off the lower back. So a lot of our patients will be going on decompression, whether it's for the neck or lower back. We have patients who come in who not only do we do decompression with them, but we also do different types of modalities and therapies with them. And we have a number of different things we can use for patients. I mean, we have everything as simple as electrical stimulation, interferential current. Those items themselves help to relax tissue, increase oxygen and blood flow. We can use ultrasound therapy with different disabled veterans, which also helps to relax areas, increase blood flow, oxygen, and really helps to relax different parts of the body.
And also, what is great about Legacy Chiropractic Clinic and every other medical professional here in the Villages is that it falls under VA's community care. That's what's so great about it, right? Right, Dr. Chris?
Yeah, absolutely. So if we have a patient, or if you are under care with the VA and you feel that, oh gosh, I would really like to be able to go into a chiropractic office and have hopefully the VA, cover this type of expense, you can simply go and talk to your patient advocate there, your doctor there, and hopefully they're very aware of what's going on with you. And you can tell them, gosh, I have a good friend, or I heard about Bill on Boss Hog Radio, and he said, Dr. Chris, Legacy Clinic, Dr. John, they offer this type of care. Would it be possible? And once you get authorization, that patient can come in for a number of visits and get, as I said, a plethora of different things. As I said, we can do decompression therapy, electrical stimulation, ultrasound. We have other things available to them. A patient, once they come in, they've been authorized through VA, they can get massage therapy. And Bill, I know you've had some massage therapy here, and we have two great massage therapists who will spend a lot of time with you and really help to work out.
And you did something on me when I first got here that I liked too. What was that? What was that machine? It was a stretching machine device, correct?
Yes, that's the decompression one.
Oh, I really like that one. Can you talk about that a little bit more on how that helps you know, everybody and disabled veterans?
Yeah, so decompression, once again, is just an apparatus that you lay on that will help to open up the spacing in your spine. So we see lots of patients coming over from the VA, lots of patients coming in from the villages as well that have this degeneration and this compression that's happening in their lower back and neck. It can be due to injury, it can be due to posture. Arthritis will normally form around those areas and cause localized pain, and in some cases, pain that radiates into the arms, the fingers, the hands, the toes, and the legs as well. So someone might say, well, I have cervical brachiitis. Patients might say, well, I have sciatica. Patients might say, I have shooting pain into the groin. A lot of these tensions and things that are arising due to nerve pressure can be alleviated if we put someone on decompression. It's not something that one visit is just going to fix, but if we're consistent with a patient, and perhaps we see them maybe once a week, maybe twice a week for a number of weeks, we can have huge results in the way that they feel. So if someone's having anything like numbness, tingling, pain when walking, all of these things, if we take the pressure off the lower back or neck, can have huge reduction of symptomatology for the individual, which is exactly what we're looking for. And that's one of the coolest things about being a chiropractor over here, is that we see patients who have had pain for a long time, and a lot of times we get them to be feeling as good as they felt in a long time with just a few visits. We had one guy come in recently, he's had hip pain for, I think he said 23 years. And for this gentleman, we were just doing some what's called interferential current with him, which is a type of deep electrical stimulation. It helps to fatigue the muscles. And we were doing specific adjustments with him. And this guy, he had a really tight lower back, really tight SI joints, which is found at the base of the laterally to the base of the spine, and his hip was stuck. And so what we did is a couple of different very specific, very controlled adjustments. And man, this guy jumped off the table, whereas first he was kind of just barely getting onto it. And he says for the first time, as long as he can remember, he's feeling great. And next time he came in, said he's been sleeping better. He's able to play softball again. He's able to walk his dog as far as he wants. So sometimes those little things in life that we've not been able to do because we've been in so much pain end up being the most important things once we get them back into our regular routine, which is super cool to watch and incredible to hear patients saying how much better they're feeling just from what we're able to do. And we're able to do it without the use of drugs and without the use of surgery, which is the greatest part.
You're listening to Legacy Chiropractic Clinic. This is Dr. Chris Kessler here on Disabled Veteran Radio here on the Boss Hog Radio Network. They're located at 1950 Laurel Manor Drive, Building 200, Suite 204 in the Villages. Their telephone number 352-259-0024, and then the website. They can also go to the website where like if they're listening now and they have a question to ask you, they could send it to your email, correct?
Absolutely. If somebody listening wants to send an email, sure. So they can just simply send it to me. My name is Chris, CHRIS, at Legacy Clinic, LEGACY Clinic.org, O-R-G. So once again, it's just simply Chris, CHRIS, at legacyclinic.org. And that's a wonderful way for someone to do that. And if somebody wants to come in for a consultation, they're welcome to do that as well. They can just simply call the office at 352-259-0024. But once again, if it is somebody who wants to get coverage through the VA, we're happy to talk to them, but to get coverage first, you do have to go to your doctor or patient advocate through the VA to get approval first. That way, once they do that and they approve you, they'll send a referral form over to us. We give you a call. We say, Bill, you've been approved for 12 visits. We look forward to seeing you here in the office. When would you like to come on in? And we'll get that all set up for you.
Wow, most excellent. And once again, that's what it's all about. And don't be afraid that, don't think, well, now I got a medical professional in the community like Dr. Chris Kessler, that he's not going to be collaborating or talking with my doctor at the VA. In fact, you do that, right? Correct?
Absolutely. So there's always going to be communication between us and back to the VA, because they also want to make sure that this patient's feeling better. And so if somebody, let's say, for example, finishes a treatment of care with them and we feel it's necessary for them either to perhaps get some more care or different types of care, we constantly refer back and forth and communicate back with the VA to say, okay, this gentleman or this ma'am here's been coming in, she's doing much better, she's gone from, let's say, a 10 out of 10 pain, now she's down to a 3 out of 10. We feel that a few more visits would be in her best interest. If they also agree with that, which 9 times out of 10 they do, then they'll just approve some more visits for that individual so we can continue to treat them, which is a wonderful thing. And it's just been a pleasure working with all the people over at the VA, because just like us, all that they want is for their veterans to feel as good as possible, as quickly as possible. And if we can do that without the use of drugs or surgery, because we're just seeing that the prolonged use of opioids and different medications over time are just never a good thing. And if we can do it naturally, safely, then that's just the best thing that we can do for a patient.
And then once they get over here, you have other items out there that the VA could possibly pay for, correct?
Absolutely. So once the VA approves a patient to come over to our office, kind of as we mentioned before, there's a huge plethora of things that we can do.
Wow.
We can do chiropractic with them. We can recommend massage and get that reimbursed to the VA. We can do different types of modalities, whether it's electrical stimulation, ultrasound therapy, in some cases laser therapy, different types of soft tissue techniques. We have 3 chiropractic physicians here in the office, so we have a really huge knowledge base between the doctors that really can benefit different types of patients coming in the door. So you don't just get approved for a specific type of visit or anything like that. They're sending you over, letting us decide what's best for you, and you're getting a whole team of doctors dedicated to helping you feel better, which is one of the greatest things that we can do to help all of our veterans. And this area where we're at specifically has a huge number of veterans, more so than a lot of other places, simply because of the retirement community built around it. So it's pretty fantastic for us to be able to provide that for everyone, get them feeling better, and also to be able to take advantage of this senior lifestyle living that we have going on around here. The greatest thing is to have someone be able to go out and play golf again, and be able to play pickleball pain-free. Go out and play shuffleboard. I don't care what it is you're doing out there. If you want to go do yoga or Pilates or shuffleboard or golf or pickleball or platform tennis, I want you to be able to get out and do it, but I also want to make sure you're doing it, and you're doing it as pain-free as possible, because that's the greatest thing. One of the worst things to see here in the villages is someone move down here or come over in this area and not be able to take advantage of the things that they want to do, whether it's golf or pickleball or all these different activities available in the area. And the greatest thing for us to do is to be able to give them that range of motion, that flexibility, that pain-free body, so that they can do anything that they want in moderation.
And of course, as they say in the villages, they always follow the CDC guidelines. You're always constantly wiping and cleaning everything down, correct?
Absolutely. So in our office, and that's a big question now with COVID-19 and everything, we are extremely careful with how the office is handled, how people come in and out. So every single table is 100% sterilized. All the doctors wear masks in the office. Everything is wiped down between every single patient. And we make sure that we keep up the highest health standards possible to keep not only ourselves healthy, but obviously all of our patients healthy. And that's the greatest thing that we can do. All of the employees, we all go through a kind of a check first thing in the morning. We kind of make sure that every temperatures are taken. We make sure that nobody's come in contact with anyone who has COVID. Nothing's going on at home that we need to be aware of, so that we can also make sure that we're providing everything healthy and safely for all of our patients every day.
Hey, the most important thing I feel is, and I admit I'm guilty missing out on it, is that when we wake up, and the first thing when we wake up in the morning is to stretch. Is that correct? Is that correct? So
if I can get most of our patients stretching, if I can get our VA patients stretching, they do so much better.
Absolutely,
I couldn't agree with you more. Someone has asked, what's the best time to start stretching? First thing when you wake up in the morning and before you go to bed. Because any time around sleep that you can stretch, you're going to do better. So if I can get patients doing just 10 minutes, 10 to 15 minutes max in the morning, maybe 10 minutes before they go to bed as stretching, we can have some huge results. Because one of the things, unfortunately, that happens if we have pain, if we become sedentary, is getting back into the habit of getting that body moving. But if I can get someone's body moving, we do great. I remember I was on a patient once to get him moving, get him just simply walking in the mornings. And I was trying my hardest to get him walking, and we were trying to get him to lose weight. His wife was also a patient. And he told me every time he came in, Chris, I'm walking, I'm stretching, I'm doing all the things you tell me to do, but it still bothers me. Well, lo and behold, the next day the wife comes in. I says, well, I'm proud of Robert. I'm proud of the gentleman coming in that he's actually stretching and moving. She says, stretching and moving, he's not doing a darn thing. I said, really? She goes, if you want, you can come over and walk with him. I said, great. So on a Saturday morning, I showed up with the dog, 9 a.m., knocked on the door. The gentleman comes in with his robe on to the door. He looks at me, kind of shocked. He goes, "Doc?" I said, "Yes, sir." He said, "Well, what are you doing here?" And I said, "Well, I'm here for your morning walk like you told me you go on every day at 9 o'clock. And guys, he had just rolled straight out of bed. So he goes in. I hear him screaming at the wife, "I can't believe you told him where we live." We went on a mile walk with the dog, and guess who's walking every day now? Walking, stretching, getting his blood flow.
Wow.
It makes the biggest difference in the world if I can get a patient to start to move their own body. Because if they start to move their own body, they'll build strength, they'll increase oxygen, they'll increase blood flow, they'll build bone density, and it also helps with anxiety levels, helps with energy levels, increases libido, increases sleep, increases eyesight, increases digestion, all the things that we want in life if we just can get our butts moving a couple times throughout the day. All of my patients, I try to encourage them to move 150 minutes a week. Some of my patients say, 150 minutes, doc? I say, yeah, just 5 days where you move 30 minutes. And I don't care what you do, and I don't mean that negative. It's just whether you want to do yoga, or you want to swim, or you want to go out and play pickleball, go out and do it. But make sure you do it 5 times a week for 30 minutes. The other big thing that I see in here, besides getting patients moving and stretching, is water. One of the biggest things I see patients come in with is just a big level of dehydration. Patients are not drinking the amount of water that they should. And if I can get a patient simply, the goal is to try to reach half of your body weight in ounces of water a day. So if I have someone who's 200 pounds, I'm trying to get them to drink 100 ounces of water a day. And it's not beer, it's not wine, like my patients always ask, just water. And if you do so and you're consistent with that, just like exercising, it helps all the body functions throughout the day, throughout the week, and just makes you a better, happier, healthier person.
There he is, Dr. Chris Kessler from Legacy Chiropractic Clinic, 1950 Laurel Manor Drive, Building 200, Suite 204 in the Villages. The telephone number 352-259-0024. And the website again where they can contact you through an email address.
So if they want to contact me through email, it's just Chris, C-H-R-I-S, at legacyclinic.org, O-R-G. So Chris at legacyclinic.org.
And we'll think of something for next month to talk about for another
deal.
Good segment. That sounded like it was pretty good. Thank you, Dr. Chris Kessler.
I look forward to it, Bill. Thank you very much for having me on.
Thanks for being on Disabled Veteran Radio.